Welcome to the Congressional Black Caucus's Task Force on Health, Nutrition, and Wellbeing. This event is Building Healthy Habits. I am pleased to be joined by my colleague, Representative Don Davis, alongside of Dr. Jen Cadenhead. I practiced that. I hope I got it right from
Good
Columbia
job.
University. And USDA Food and Nutrition Service Administrator, Dr. Tameka Owens. I'm very excited to start this conversation, and I'd like to throw it over to my Congressman, Don Davis, for some opening remarks.
Hey, thank you so much, Madam Co-Chair, and to the participants. Thank you so much for being a part of today's conversation. I look forward to having a very wonderful and productive dialogue today. So thank you again for being with us today. And I turn it back over to you, Madam Co-Chair.
Wonderful. Let's get started. We can't think of a more important issue than talk about nutrition and its impact on our well-being, particularly as it affects Black and Brown communities. So let me just start by asking my first question. Appreciate it if both of you would even respond to it. What disparities are present in the food and nutrition landscape regarding minority and Black populations as we are living and breathing and speaking today? Start with you, Dr. Caden, and on to you, Dr. Owens.
Well, first, I'd just like to say thank you. It's an honor and a privilege to be here. And this is such a near and dear and important topic to me. So you ask a really important question. And I would say a lot of what has happened is that, one, our food system in general is not ideal, but Black and Brown people are almost the canaries in the coal mine because Black and Brown people are less likely to be able to afford good quality food, and also because of the history of redlining and a long history of systemic racism, live in neighborhoods which have less access to healthy, nutritious foods that are affordable and culturally responsive.
Thank you. Dr. Owens, you would like to add on to that?
Yes, ma'am. I'd like to echo Dr. Cadenhead's appreciation for being invited to have this opportunity to speak with you all. I echo everything Dr. Cadenhead said. I think other disparities to just kind of be cognizant of as we think about food and nutrition is the number of households that have small children under the age of 6, that are headed by single females, but also just being aware that while we try to shield children from from food insecurity, it is definitely something that we have to be cognizant of in ensuring that they have access and dependable access to food. Otherwise, we're exacerbating problems later in life. So just being aware of that. Obviously, you mentioned that minorities have greater health disparities and greater challenges when it comes to the food and nutrition landscape that kind of shape the context of which we're having this discussion.
As we cover this issue, I think it's important just to note some of Dr. Cadenhead's work as it relates to the findings of the relationship between the degree to which there's this unhealthiness and the fact that it is related to insufficient nutrition. And this being insufficient nutrition being a leading cause in our health outcomes. Congressman?
Mm-hmm. I represent a rural community, and we often find in rural communities, people live where massive amounts of food is actually grown, yet they aren't able to afford food from nearby grocery stores. Can you speak on the challenges in particular that rural communities face when dealing with these local challenges?
Sure, I can start, sir. Thanks for the question. You're absolutely right. Our rural communities face a different set of challenges. We saw in the most recently released study from the Economic Research Service on food security, we saw food insecurity in rural communities rise from 10.8% in 2021 to to 14.7% in 2022. So it's definitely a troubling reminder that while you live where lots of food is grown, it's definitely still a struggle to put food on the table. And it's not just about the availability of the food, but there's financial constraints because rural households tend to pay a larger percentage of their income on food compared to urban households, making food unaffordable in some cases. But there's also transportation challenges, as well as being in a rural community might also mean that you are living in a food desert where getting to food is a challenge. So I would think those are some of the challenges that rural communities in particular face.
Yes, and I'd echo everything that Dr. Owens has said, and I would just like to add that it's good to point out that some of the opportunities that are available in urban communities, access to more GusNet funding, for instance, could be a reason why there are disparities, but also just to note that as the statistics that Dr. Owens just stated, there were additional supports put into place for people during the COVID pandemic that did reduce food insecurity, and we are seeing now more significantly in rural areas, but all across the nation, that people are experiencing extreme rises in food insecurity.
You know what, I'd like to follow up on that question a little bit. What are some of the factors that lead to this increased food and nutrition insecurity in minority communities, in the rural communities? And I think it's good that we're discussing the impact of both in rural communities and in urban communities. So we don't want anyone to think that this is any one community's problem. This is a problem that we experience in the United States. But why is the Farm Bill so critical in decreasing these identified factors? What are some of these factors, and how has the Farm Bill addressed them? Why is it so important?
Yeah, the Farm Bill provides critical support for families and in fighting food insecurity. Products like SNAP have traditionally been lifesavers for families. Again, during COVID, there was an increase or supplement for SNAP benefits that help to reduce food insecurity. Some of the things that could be done through the Farm Bill include readjusting the way SNAP benefits are determined, so that like right now, people are getting about $6 a day for one person to be able to provide food, which is just really not enough if you're working a job and having a lot of constraints and just paying the rent and basic bills, and you're depending on that money. So you could actually increase the food plan so that people have a food basket that provides adequate nutrition for them, as well as, and I don't want to hog the whole time, but increase the availability for different categories of people. So for instance, people who are nonviolent drug offenders, when they get out of jail, they're precluded from SNAP, and many other categories of people. Also helping our older residents of this country be able to get SNAP benefits. There's a lot of access issues. We already have a lot of things in place, but making them a little bit better and stronger for families that are really struggling could go a long, long way.
Thank you. Dr. Owens?
I would agree with Dr. Cadenhead. I would just add the Farm Bill is critical, particularly for programs at the Food and Nutrition Service for SNAP, as Dr. Cadenhead mentioned, but the Farm Bill also addresses issues such as food deserts, as well as providing research and extension programs to help think about agricultural productivity and sustainable farming to make sure that there is a steady supply of nutritious food, but also local food systems like farmers markets that are critical to ensuring that we have access to fresh food that is accessible by some of the marginalized communities that we're talking about here. And the last thing I would say is that it's also the SNAP Employment and Training Program is also a part of the Farm Bill. And that helps transform lives by providing skills, training, and work experience so that folks can enter, re-enter, or remain a part of the workforce to address some of the structural constraints that we've talked about earlier.
Thank you, Dr. Owens.
Let me share the Farm Bill is huge, it's massive, it touches every congressional district, every community across the nation. So really appreciate the insight there. I want to come back for a second towards rural communities access. I've heard Dr. Owens, you mentioned food deserts several times now. Rural communities often face another dynamic, and that's the challenge of having no grocery stores nearby, as opposed to my first line of questioning. I've heard from people in my area and across the nation who have to drive over 30 to 45 minutes to reach the closest grocery store. And in some cases, they're trying to pay a friend or a neighbor just to get them, to the grocery store. And sometimes those can be high prices that, our neighbor may even charge. What can we do? I've heard you comment some within the Farm Bill regarding access. What might you suggest, whether it is more in depth with the Farm Bill or beyond the Farm Bill, at really tackling this access and closing the gap with food deserts?
That's a very important question, and certainly empathize with having to travel significant lengths to get to a grocery store, particularly when you're juggling multiple children or working multiple jobs and trying to make ends meet. Certainly want to maximize the amount of funds you have available. I will say that one thing that at the Food and Nutrition Service that we've had the opportunity to do was that in 2019, the Farm Bill helped with this. We launched a SNAP online purchasing pilot that allowed SNAP participants to shop electronically, just like everyone else in America has the opportunity to do. And so it provided participants an opportunity to select and pay for their groceries online to address some of the problems that you just talked about. And while we had to speed it up a bit because of COVID, we quickly scaled that in a way that as of April of this year, nearly 3.7 million SNAP households have shopped online, which is a significant increase from the 35,000 that we started with. So I think that that's one opportunity to continue to make sure that we can address some of the challenges that you highlighted. But also through the Rural Development Program, it's called the Healthy Food Financing Initiative. It provides loans, grants, and technical assistance to support access to fresh, healthy, and affordable food, not only in rural communities, but also urban and other underserved communities. So I think those continue to be opportunities that we can explore in the Farm Bill.
Dr. Cadenhead, do you have anything you want to add to that?
Yeah, I wholeheartedly agree with everything that Dr. Owens has said. And I would just add that being able to provide funding, as she mentioned, maybe through GusNEP incentives to grocery stores in rural communities could also incentivize people or organizations to have more grocery stores available, and also just having demonstration projects to find solutions that work for people. A long time ago, my father, who grew up on a farm, had a grocer that would come to them and actually service them. So, coming up with innovative ways to solve this issue may be another approach as well.
Thank you. I'm going to touch on an issue that I've been doing some work with, and the more I enter this field, the more I realize that the problem is vast, and that is the whole issue of mental health and well-being. I'd like to explore with you both, actually, your experience, your observations, and your research, and revealing the intersectionality between insufficient nutrition and mental and physical well-being. I'll start with you, Dr. Cadenhead.
Thank you for that question. My dissertation research actually was on diet quality, diet patterns, ultra-processed foods, and quality of life, which measures different measures of well-being, including physical and mental well-being, and is a predictor for mortality and morbidity. And I consistently found that whatever what you're eating overall, your diet quality overall, the higher it is, the better your quality of life is going to be. And that's true in many other studies as well. But that's especially true the older you get. But if you have to recognize that children, as they're growing, they're developing their brain, like their frontal lobe is literally being formed by the nutrients that they're getting. So a lot of behavioral health issues are actually, dysfunctions within the brain, and some of that could be caused by the nutrients that they're not getting as a child. There's a strong association between depression and poor quality diet, as well as high amounts of ultra processed foods, which, as we have seen during COVID, people were relying on these foods, which are low in nutrients, but easy to get, and because they're shelf stable, more affordable. So, there's a very close correlation between all kinds of wellness issues, including diabetes, cardiovascular disease, cancers, the top killers of American society, and being able to have access to healthy, nourishing foods.
And it is true that we have a disproportionate negative outcome as it relates to experiencing those particular diseases. And in addition, for children, both quality and quantity impact their learnability, it seems. Dr. Owens?
Yes, ma'am. I would just add that when you're food insecure, it can also be very socially isolating, which can lead to the depression and anxiety that Dr. Cadenhead alluded to. Particularly, we talked about in the pandemic how folks were isolated, and we saw tremendous increases in levels of anxiety, but also depression. And so that becomes another component of why it is critical that we make sure that children, adults alike, and particularly our older adults, have access and dependable access to healthy and nutritious food, because of the comorbidities that exist when we don't have access to that and have to rely on lower quality meals.
Thank you.
Hey, now, this is CBC, and our CBC family, I have a really important question here. So the Black community's strong cultural connection to food can run really deep. Our food can tell the story of our history, and yet certain beloved traditional meals have been linked to health concerns such as high cholesterol, diabetes, and therefore create health disparities. Maybe I can speak about myself right now. I'm thinking about Thanksgiving and really getting ready for that Christmas meal that we traditionally enjoy. My question is, how can we explore healthier options while honoring these rich cultural and culinary traditions?
So I can jump in. I too will draw upon Thanksgiving and the upcoming Christmas and New Year's holidays. I think it is one that we have to tackle. As we talked about in the earlier question, food has a very strong link to not only our physical health, but also our mental health. It's something that I've personally taken on with my family. My husband and I hosted Thanksgiving this year, and we don't traditionally cook with salt, but of course, I mean, my mom is the boss, and so we kind of do what we're told. But I took the opportunity to explore the use of different herbs and other spices that didn't have such an impact on cholesterol, and trying to reduce our sodium intake during the holiday while still enjoying the flavorful nature of the food, because that's an important part of kind of the gathering and the fellowship. And so I will just highlight that there's also another USDA initiative underway that is being launched in partnership with Southern University, which is an HBCU. But it is called Ascend for Better Health, and it is doing exactly what you're talking about in terms of thinking about science-based, nutrition-related information. How do we get that out to the community and make sure that they understand the connection between food and our physical and mental health, and thinking about how do we do things a little differently, but do so in a way that honors that tradition, because otherwise you're up for quite the battle. At least in my house, you're up for quite the battle. But I would also say that there's a lot of resources available to communities. The My Plate, which folks are used to the pyramid, but it is now called My Plate. There are a host of resources there to help folks look at the things that we like to eat and how to make them healthier, and just explore opportunities there as well.
Well, Dr. Owens, I think we're all coming to your house for Christmas.
You're welcome.
Dr. Cadenhead.
Thank you. I'd like to add that in addition to being a behavioral nutrition research scientist, I'm also a registered dietitian nutritionist. And I had the pleasure, honor, I don't know what you want to say, of going to Africa for the first time this last summer to see how people are actually eating. And the thing that I noticed that resonated with me right away is I was visiting Ghana, and there was very little incidence of overweight or obesity there. People maintained, for the most part, like a plant-based diet. And, they didn't really have the same level of chronic diseases that people have here. They have different kinds of issues, health issues that they're dealing with. So I actually think that the part of what's going on here is understanding that there's two different things. African Americans, what people eat now is actually a little bit different from what the diaspora originally was eating. We have actually had a lot of our food influence from the food industry, which we sometimes have adopted, and we sort of need to understand where the marketing is and how to reclaim our actual heritage. And I actually think that like SNAP Ed is one of those things that can help people understand that you can still have amazing flavor. You can have your collard greens. I made an amazing collard green black-eyed pea stew with yams just the other day in my Instapot, for instance, with a lot of different spices, which I think the whole family thought was quite delicious. It was Ghanaian inspired. So you can still have all of those flavors, and you can say no to the type 2 diabetes or the cardiovascular disease. You can actually sort of roll back some of those things possibly with adopting different kinds of preparation methods and understanding the difference between what is actually marketing and what is actually tradition.
Hey, Dr. Cadenhead, your stew sounds absolutely delicious, and I'm going to get my husband to try it one day. But I can see my Christmas table. I need to see the greens. I need to see the yams. I need to see the macaroni. Not me, my family. Need to see the macaroni and cheese, and then whatever else that we're going to have. And then I'd like to really know when New Year's comes, how do we make chitlins more healthy for you, Or do we just ask for a pass? Lord, give us a pass during the holiday season, and we'll get back to all the good stuff that Dr. Cadenhead and Dr. Owens has told us today. But in all seriousness, we have embraced a eating habit that isn't necessarily the healthiest. Some of it came out of our, being here and being given what was left over that other folks didn't want. But how do you get healthy eating habits? And if you don't have them, how can you kind of discipline yourself? What is it? Where do we go for some help?
Yeah, again, if I could just reiterate SNAP Ed, getting evidence-based sound nutrition advice is something that I think everybody should take, like at least a little course in nutrition from someone who has actually studied nutrition, because even though we all eat and think that we're experts in food, we're as a society, I don't know if Dr. Owens would comment on this, but we have this thing called the U.S. Dietary Guidelines, and they are created by an expert panel of nutrition researchers. And we grade the American diet on a thing called Healthy Eating Index. As a country, we're not eating very well. So we all pretty much could use some lessons. We develop our eating habits very young. Even in the womb, we're tasting from the amniotic fluid the flavors that your mother is taking in through her food. And then when you were a very young child, like 4 to 6 months, that's the magic window of opportunity to start introducing foods. And then when you become a toddler, you sort of want to reject these things and have your independence. But even after that point, you can still introduce foods to people. You can make an effort to try to have new foods in your diet. So, for instance, we work with children in New York City schools, and just having a tasting, which might mean that a child is looking at something or smelling foods, not even eating it, can help with exposures. If you have at least 15 exposures, they say, is when you start to develop a taste for it, even if you didn't like it. So now my mother would be proud to know that I eat eggplant, and my father-in-law, after 20 years of eating its rutabaga, I actually am able to eat it successfully, but you can change too.
Hey, Dr. Owens, are we including, I know we have a desire to expand what you can purchase on SNAP and encourage more vegetables and more fruits and things of that nature. Are we also sending out routinely information to our recipients on how to shop more healthily, how to eat more healthily as well?
Yes, ma'am. I think Dr. Cadenhead hit on this a number of times earlier through SNAP Ed. So, but it's not limited just to SNAP Ed, right? I mean, across the programs that FNS offers, Dr. Cadenhead touched on, it starts in the womb, right? What the mom is eating and what the embryo is exposed to at that point. That's part of the Women, Infant, and Children's program that FNS administers as well, right? Making sure that moms have access to healthy foods as they are growing the next citizens of our country. And so making sure that from the very beginning that folks have access to healthy foods and know what that means, right? I mean, it's not enough to simply say you need to eat healthy. You have to have the educational components of what healthy looks like. And the dietary guidelines for Americans provide one avenue for this is what a healthy diet looks like. But our programs at FNS put those into action through SNAP Ed, through WIC, through the National School Lunch Program, and just having that exposure to healthy meals and what that looks like is an important piece of that. And for us, I'll speak about myself, kind of changing what we've been exposed to requires, it's not a rip the Band-Aid off approach. It is a very slow and very deliberative approach. And I would say that myplate.gov is another resource that we can use to kind of explore how do we make those dietary changes so that we contribute in a positive way to our long-term health.
Thank you.
And could I just add one thing? As Dr. Owens mentioned, the National School Lunch Program, that is a critical and important part of nutrition for our school children. Is since the Healthy Hunger-Free Kids Act of 2010, it has been the healthiest meals that most Americans eat. And I think maybe when some of us were children, we remember different kinds of school meals, but it's really important for parents to encourage their children to eat the school meals if they're available.
Thank you. Representative Davis?
Yes, Dr. Cadenhead, I want to thank you for your insight and perspective on this historic evolution, so to speak, of food. And something that came to my mind was this: we are reminded perhaps we need to go back to our roots. When we think about, even plant-based diets. We've covered so much ground today, talking about access to foods, those barriers, different programs, Dr. Owens, the USDA and that's coming out of the Farm Bill. My question is, how can we make nutritious foods more accessible, in particular to the marginalized communities? And more importantly, how would you assess if this was a state of the health for Black communities and our ability to deliver nutritious foods to marginalized communities specifically? How do you think we fare right now, and what changes perhaps should we consider?
Just more broadly, I think we're not doing a great job for most Americans. But again, as I mentioned, I feel like Black and brown people are sort of the canary in the coal mine, because typically Black and brown people have less of a voice and are listened to less. We don't have policies in all of our communities that ban them from turning into food swamps, places where you just have access to mostly fast food or ultra processed foods. We should strengthen the requirements for grocers to stock certain types of foods. That in itself would go a long way towards improving access to foods. But again, like Dr. Owens was mentioning, providing training to people, providing supports for farmers to be able to grow these kinds of foods in their local communities or in nearby cities, providing support for local food in America. We have a very international food system, which is great, but I think the COVID pandemic revealed there are shortcomings to that, including providing on a regular basis local foods to people, which if we were reducing food waste, we actually produce more food than many times over than what we need in the country, but we don't get that food to people. So being able to improve those kinds of things could improve the system too.
Dr.
And I would just jump in, Congressman Davis, and just add that at FNS, we have the 16 nutrition programs that form the federal safety net, if you will. And I think that one thing that I would like to just highlight for folks is Congress created a new permanent program for states and eligible tribes related to summer EBT. We talked a little bit earlier, and Dr. Cadenhead highlighted that sometimes school lunch is the healthiest meal that children receive. And so you get to the summer months and that is gone. And so very appreciative of Congress taking the important step of making sure that not just during the school year, but also during the summer months where we typically can see some issues with food security, by having the summer EBT program and the non-congregate feeding option, particularly important for rural areas, provides us an opportunity to really make continued investments and impacts in the health of our children. And so that's one thing. The other thing I would say, talking about the education piece, USDA recently signed a memorandum of agreement with the Department of Veteran Affairs that hammers home the importance of educating and empowering veterans to improve the quality of their life through nutrition and food security as part of their educational component. So there are there's not a one size fits all, and we all have to be part of the solution. And I will just finally add the WIC program, with Women, Infants, and Children's program, is particularly important when we talk about racial disparities in maternal and child outcomes, because we have the participation rates are highest among the Black and brown communities. But I do think it's really important that we think about how do we provide access to a healthy diet across the life cycle. And that is part of what our mission is. And as we think about the Farm Bill, thinking about that across the continuum of life would be really important.
I think that we have scratched the surface of a really important community discussion that perhaps we need to think about some additional time together get more thoughts, and perhaps you can give us some more of your ideas and directions where the Congressman and I could work together here on the Hill. But I am grateful for having this opportunity to listen to you, to learn from you, and to have you share with us. And I wish you the very best holiday season, healthy eating, but with a little taste of you know what. But thank you for your work and your commitment. Congressman?
I was told it's all in the seasoning. So, I would like to thank the panelists and everyone who participated today, and what words of wisdom for us to hold on to. And it's always an honor to join you to the co-chair.
Thank you. You too. God bless. Thank you.
Thank you.
Thank you.